Hello, my name is Bertram Warren. I'm RN working in a healthcare facility, and these are co-workers I'm giving an in-service on managing acute behavior crisis. I have each one of them to introduce themselves.
My name is Mr. Bush.
Ms. Maggie.
Mr. Antoine.
Jeff Little.
Josephina Ball.
And Mr. Andrews is doing the recording.
Hello.
Thank each and every one for helping me to facilitate this discussion. Okay. We're going to talk about, I have two objectives for this learning. And the first objective is to, is to how to recognize escalate behavior in a client. And the second objective is to give you strategies to use when a client is escalating to prevent harm to themselves or to other staff members. Okay? The purpose is staff safety and prevention measures. And the key to all of this safety is prevention. You got to recognize the patients may express themselves using behaviors in an attempt to have their needs met. So we recognize that all the time in this healthcare setting. They may pace, patients may appear agitated, they may cry out, they may appear needy. All this is an attempt to have their needs met. So you want to be aware of the signs of that their behavior is escalating, and patients may become violent if it gets to a point where they're up here. So be aware of things that might trigger the patient's behavior and share that information during handoff and share it with your peers. So here we do a handoff shift report from RN to RN, and then we share our information with the staff on the unit. And at the end of the shift, staff do a staff-to-staff handoff report where they walk around each patient room and share what's going on with that patient throughout their tour. You want to use the escalation techniques to diffuse the potential volatile situation. And you want to share specific strategies with staff to reduce the risk of violent injuries to themselves, visitors, patients, etc. Today we're going to talk about the ABC model of behavior-based practice. ABC stands for activator, behavior, and consequences. And in this model of behavior-based practice, activator is the person, place, or thing that coming before the behavior that encourages you to perform that behavior. Behavior is something that you can see that the person is doing, and consequences are the event that follows the behavior and change the probability that they will occur in the future. There are several benefits to the ABC method. Use, it increases the frequency of safety-related behaviors. It decreases the occurrence of the risks and behaviors. Prevent workplace injuries and fatalities. Provide accurate documentation of the events. And help in the revision and update of care plans. It also provides information that may be useful to caregivers, physicians, social services. That's why documentation is so important here, because you can always have a reference in the client's record. Support requests for additional resources and to help communicate the most effective care approaches. So those are some of the benefits of ABC behavior. Direct and activator and motivator with consequences. We do what we do because of consequences we expect to get or escape or avoid from doing it. So it had this little cartoon here. Patient is sitting in a corner. What he says, have thought about my action and realized my desires for instant gratification clouded my judgment. Excuse. But as I said before, the exhibit behaviors because of unmet needs. So whenever you see one of the patients exhibiting certain behaviors, first of all, we want to try to find out how we can help them. And you can do that by monitoring, by talking to them if it's safe to do so, and trying to find out what their needs are. There are signs that behavior may be escalating. And it starts with pacing, things that the patient may be doing that are out of norm for that patient. Or if it's a new patient, you don't know the behavior yet. You watch them, you monitor, see how you can help that patient. You just kind of watch it. Tantrums, screaming, swearing, destruction, threatening, physical abuse, all those are signs that the behavior is escalating. Prevention is the key to avoiding escalation from the current situation to a more disruptive one. The ability to behave in a preventive manner is dependent upon the ability to assess yourself, assess that patient, and assess your surroundings. So prevention is the key. Being alert to both predisposing and precipitating factors gives you a basis for a decision that you would need to make about that appropriate intervention that you would use for that patient. So all these things have to be assessed. Yourself, first of all, the environment, and more importantly, that patient. Response to escalation. When you see the patient start escalating in the behavior, getting to the point where they could become volatile, what you want to do is, when you see that a patient is anxious, you want to listen and try to comfort that patient. When you see they're angry, you want to try to give them space, but you want to still monitor the patient. If they're hostile, you want to try to speak in a calm voice and try to find out where the hostility is coming from. Also, in the back of your mind, you should be making plans. If you're in an enclosed area, how are you going to get out? How are you going to escape that situation? Aggression. You want to allow that patient to diffuse. You want to try to distract them if it's safe to do so. You want to maintain your distance. They teach us that in PBMB. Prevention and management of disruptive behavior, PMDB. Okay, you also want to call for help. The co-worker should always be around, always. Increasingly violent situations, follow these guidelines. You want to maintain or increase the personal space between you and the patients you become involved with. You don't want to argue or disagree with the patient. This may further escalate them. How many times have we seen that here? It only makes the situation worse. Try to diffuse the situation by distracting or calming that patient out if it's safe to do so. If others are in the environment, you want to quietly and safely as possible remove those patients. Okay? If the environment is cluttered, whatever, you want to make sure you assess the environment for safety. Remove yourself from the situation as soon as it's possible to do so. You want to contain the residents in a safe zone. And as I said before, remove all environmental hazards. Call for help. Here at this facility, we use code gray. We also use control on computers. We're at a computer. Government should always respond by a show of presence, which itself may diffuse the situation by showing that that staff has support. Your stance and your body position also may either further escalate that patient or it may show him that you're not threatening, that you're there to help. So you want to be in a relaxed posture. As I said before, you want to always be at a safe distance. When you be at eye level with the patient, you want to ask, how can I help you? Rather than, you must do this, or you have to do this. Body language should convey choice and not control. Because a lot of times, it's about giving up that control that for the escalation patient. They're here on a locked unit. That's a loss of control. Told what time to get up, time we're having treatment team, what time to eat. All those things are loss of control, believe it or not, because at home or wherever, they do these things whenever they want to. So there's a little loss of control. You want to maintain a safety zone. So you want to stay far enough away from the patient that you can't get hurt whenever it's possible to do so. When working in a high-risk situation, you want to be vigilant. Okay? You want to remain calm. You want to work together as a team. Even when you're having to do a PMDB intervention, you're always working as a team. Be aware of your surroundings. Move in and dangling objects that the resident can grab. Earrings, chains, name tags, anything they can grab hold of. Be sure to try to remove those. And avoid hair pieces, jewelry, anything that the patient may use as leverage. You have to have proper footwear. Here on this unit, there are many times that we have to face situations where the patient may become volatile, especially on admission. A lot of times these patients haven't had medicines for a while. They may be going through a manic episode, bipolar, they may be going through a psychotic episode. So even though we are administering care and try to be empathetic as possible, we still have to be safe. So the objectives of this discussion was, first of all, to be able to recognize when a patient is escalating and give you strategies to remain safe during those periods. Do we have any questions? Do I have any questions?
I just got a comment, man.
Sure.
Okay, you talked about the self-assessment, and I've heard different discussions on this topic, but rarely have I heard anybody talk about the self-assessment, and that was a good thing, because sometimes when it's time to do an intervention, you made me think, hey, sometimes an intervention needs to be done, but I might not be ready to do it. Okay, and what we present to that patient, especially at that time, could be real crucial.
And not only that, you might not be ready to do it. You may be even at a higher point of escalation than that patient.
Yes, sir. Exactly.
And therefore, you may further escalate the patient.
You're right.
So you need co-workers at that time to step in
Yeah.
and to remove you quietly.
That teamwork, like you said. Yeah.
Teamwork.
Yeah.
Okay. Thank you all for participating, and keep up the good work.
Yes, sir.
Thank you.
All right.